your problems?
Well, doctor, I have been experiencing double vision since 2 days, and this is something really annoying, doctor. I'm seeing double.
Okay. Is it the first time or before also?
No, this is the first time to experience such thing, doctor.
So at what time of the day you are having this problem? Like in the morning, night, or whole of the day?
No, the whole of the day, doctor. There is no specific time for that.
Is it increasing or decreasing by anything?
Well, doctor, I'm not sure.
Okay. And is it with like if you're closing one eye, then is it improving
Yes,
or is it
doctor. Yes. When I'm closing one eye, I'm seeing normal, doctor.
after closing which eye you're seeing normal?
Both of them, doctor. If I've closed the right one, I'm seeing normal. If I've closed the left one, I'm seeing normal, doctor.
Okay, ma'am. So is there any redness in your Mhm. Yes, ma'am.
Okay.
Is there any redness in your eye?
No, doctor.
And is there any problem in like blurring?
No, doctor.
And can you see properly, or there is the like decrease in the eyesight also? Like you
No,
can see there, not like that.
no,
Any watering?
no.
Okay, fine. So are you suffering from any illness in the past?
Yes, doctor. I've got diabetes and hypertension as well.
For how many days?
It's not days, doctor. It's years.
Yeah. How many years?
Well, doctor, I have been diagnosed with diabetes for the past 10 years and hypertension for the past 6 years.
And how is its control?
Well, doctor, I'm a good with the controlling my hypertension, but to be honest, doctor, I'm not good with the diabetes control. My GB, he's not happy at all.
How was your 3 months control of sugar?
Well, doctor, recently it was 8.5.
I'm sorry about that. And how's what medications you are taking for your sugars and blood pressure?
I'm taking insulin, metformin, and lisinopril, doctor.
Okay. And is there an increase or decrease in any medication?
No, doctor, there is no recent change in doses.
Okay. And is there any other over-the-counter medicine you are taking?
No, I'm not taking any, doctor.
Okay. And do you have any headache also along with eye problem?
No, no, doctor, I don't have any headache.
Any weakness in any part of the body?
No.
Any tingling numbness?
What do you mean by tingling numbness, doctor?
Some numbness in the feet or
Okay,
leg?
it's a jargon. Tingling numbness, it's a jargon. So any pins and needle sensation. No,
Okay.
doctor, I don't have any pins and needle sensation.
Okay. And okay. And can you walk properly or any problem in walking also?
No, doctor, I don't have any problem with my gait.
Any chest pain,
No,
shortness of breath,
no.
tummy problem?
What do you mean by any problem, doctor? I've got double vision.
Like, okay. Okay. And how is your water work?
It's fine, doctor.
And how is your motion?
It's good.
Okay, fine. So I need to examine you. And meanwhile, I will ask few more questions. Okay.
Okay, sure, doctor.
Okay. So I'm going to see patient and sitting in front of the patient. How's the pulse, BP? Yeah, I saw it's normal.
Okay, like
And
outside.
hello, ma'am.
Yes, like outside, doctor.
Yeah, and the pulse is regular.
Yes, it's regular average volume.
Okay, and I'm seeing eyes. So like I'm making H-shaped movement. Then movement is normal. It is.
Okay, have a look over the H-shaped movement.
Pardon, ma'am.
Have a look, please.
Okay. Okay, right side.
Okay.
Yes, ma'am. And then I'm seeing pupillary reflex. Is it normal both side?
Yes, it's normal, reactive both sides.
I'm seeing visual acuity. It is okay.
Okay, are you going to check the visual acuity after a shaped movement, doctor?
Okay.
Okay, 2 minutes remaining.
Okay. Say I need to check about fundus also. Is it
Oh,
fundus okay?
okay, no need, doctor, skip it.
Okay, fine. So, okay. So, what job you're doing?
Sorry?
What job you're doing for living? What is your profession?
Well, doctor, I'm a teacher.
And your problem must be affecting your lifestyle.
Yes, doctor, I wouldn't be able to cope with my job anymore.
We will definitely do something. So,
Thank
I
you.
need to ask, and with whom you're living?
I'm living with my husband and my son, doctor.
And there must be proper support at home.
Yes, doctor, they are supportive.
Okay. So, may I ask what is your concern?
What do I have, doctor? Why I'm seeing double?
Okay. So, Miss Anita, as per our examination in the history conversation, we
खड़ी हो
heard
जो
you
गार्डन है
thinking.
खड़ी हो तो जो
Hello.
गार्डन जा रहे हैं ना जा गार्डन जा जा
So,
Hello.
doctor Anam,
जा
please
जा
mute your
जा
mic.
जा गो गो गो
Yes, Dr. Kirta, please unmute your mic.
Yes, ma'am. So,
Okay.
Miss Anita, as per our conversation and examination, what we are thinking that you're suffering from one of the side effect of your problem, means long-standing diabetes, and it is uncontrolled. So, one of the nerve of your eyes is getting affected, and that's why the movements in your eyes is not okay, and one of the eyes not going up to the outer side. This is the right eye. Okay.
Okay.
So what we are going to do about it? We are going to uh, maximum optimize your sugar control so that your nerve can get better, and so that your eye problem will be okay. And simultaneously, we are
Okay.
going to take
Time up.
consultation from eye doctor also.
Okay. Time up, doctor. So, doctor, what are your positive findings within your scenario?
Ma'am, here her lateral rectus of the right eye is affected. So I'm thinking there is the involvement of the sixth nerve because of the
Okay.
uncontrolled sugar.
So, brilliant. What could be the cause of sixth nerve palsy then?
Ma'am, because of the uncontrolled sugar, there is the affection of like mononeuritis multiplexa like things.
Okay, brilliant. So, it's mononeuritis multiplex. Any other causes of the sixth nerve palsy?
Ma'am, there is the some deposition of the glycosamine around the nerves that can lead to the nerve problem in the
Okay.
diabetes.
Okay. Any other possible causes? Even
Sorry,
if you
ma'am.
exclude them,
Ma'am, especially in diabetes only.
even if you exclude them,
Okay.
okay, it could be cavernous sinus problem. Am I right?
Yes, ma'am. Yes, ma'am. It is the
O-
cavernous sinus thrombosis and the other
Okay.
differential I can like any
Yes.
ixole is there
Any
or
increasing the intracranial pressure can affect the
yes,
sixth
ma'am.
nerve. So you
Yes,
have
ma'am.
to mention that within your differential diagnosis. It could be cavernous sinus syndrome. What against that there is no affection of other cranial nerves. It could be increased intracranial pressure. What against that there is no headache. But you have to ask about the other causes, like if your patient got any nausea and vomiting and so on.
Yes, ma'am.
Okay, so
Even the
that's
thyroid problem.
thyroid. Okay, so thyroid will never be explained by single cranial nerve.
Okay, yeah, yeah, complex
Okay.
neoplasias there.
Yes, it's
Yeah.
going to be complex in multiple directions. Okay,
Yes, ma'am.
you've done very good, Dr. Kerti. However, you've done some fatal mistakes. Do you think that your patient driving or not?
Yeah, sorry.
Okay, do you think it's important to raise this issue?
Yes, ma'am.
Yes, ma'am. Okay, are you going to check the H-shaped movement without knowing her acuity, whether she would be able to see clearly or not?
Mhm.
Okay, this is a fatal mistake. Do not do the H-shaped movement unless you've checked the patient's acuity. Then, once you've checked the H-shaped movement, you have to instruct your patient regarding two things. The first thing is whether if you, Mrs. Marta, if you see double or if you feel pain, please let me know.
Okay,
Because
ma'am.
she was seeing double in certain gazes and she didn't tell you because you did not ask her.
Okay,
Okay,
ma'am.
so once you are going to do the H-shaped movement, you have to keep in mind two things. Checking the visual acuity before the H-shaped movement. And once you are going to go for the H-shaped movement, you have to ask the patient if you see double or if you feel pain, let me know. Yes, it's a case of sixth cranial nerve palsy. So sixth cranial nerve palsy that just before the management. What could be the causes? It could be ischemia. What do you mean by ischemia? I mean by ischemia. So let's make it here. So it could be ischemia. What do you mean by ischemia? I mean like diabetes, hypertension, and vasculitis will lead to mononeuritis multiplex. And it's going to be painless. And then any raised intracranial pressure, cavernous sinus thrombosis or cavernous sinus syndrome. Multiple sclerosis may affect the sixth cranial nerve because it's within its course within the brain, it's heavily myelinated. So that's why it could be affected by the multiple sclerosis and basal meningitis as well. So how would you manage your patient? Simply, I'm going to go for the MRI, sugar profile, autoimmune screen, and then treat the underlying cause. If it's medical treatment, you are going to optimize the sugar, like you've mentioned for your patient, and just wait and see. It's reversible in most of the cases within 6 weeks. And if it's a neurosurgical cause, like your patient got something leading to increase the intracranial pressure, you are going to transfer him to the neurosurgery. Is it clear, doctor?
Yes, ma'am. Thank you so
Okay,
much.
you're welcome. Do you have any question within your case?
Yeah, ma'am. Actually, time constraint is too much. Like I was trying to do examination for neurological also should be there, na? But time is not sufficient in the station
So you
file.
don't have time because you've asked too many questions. You have to be targeted more than this. You've asked whether you've got any redness or not. So this is like an extra question because you are going to examine already. Do not ask about the redness. Okay?
Okay.
You've asked whether this diplopia disappeared after closing one eye or not. And you can examine for that rather than questioning upon this. Once you've got diplopia in certain gaze, you are going to ask the patient to close one of the eyes. If she's going to see double or not at this gaze, and most probably this diplopia will disappear.
Mm-hmm. Okay, ma'am.
Okay, so do not ask too many questions and do not ask questions that you can examine for those questions.
Okay, ma'am.
Okay, is it
Yes,
clear
ma'am.
now?
Ji, ma'am. Yes, ma'am.
Okay, do you have any question, guys, within this scenario?
Ma'am, in this scenario, how many marks I can get with this performance?
Okay, so because you've missed the driving, because
Yes, ma'am.
you've done the H-shaped movement before checking the acuity, those are the most important things which is going to affect your clinical judgment, as well as it's going to be affect your steps of examination. And because you don't tell the patient if you see double or if you feel pain, let me know, this is going to affect the patient's welfare as well. So roughly you are going to have 18 or 19 despite you've picked the diagnosis.
Okay, ma'am. Thank you, ma'am.
Okay, you're welcome. Any question, guys?
Ma'am, can
What to
you tell us?
Yes, Dr. Arshad?
do? Don't you think that
Examining the patient first is important in this case. It will save time. Examine the patient first, and then if you are not sure about some findings, you can take history about that. It will save
Okay,
time.
it's up to you. There is no any kind of organization and station for. So it's up to you to start with examination first. And I believe within any eye complaint, start the examination very early. It's going to be something very valid. But do not jump to the examination without asking at least clarification question.
Yes, madam. Madam,
Yes,
can you
doctor?
please explain
Yeah.
cover test? Like, how will you be do the cover test? Like, how will this diplopia disappear? And like, I'm confused about.
Okay, let's agree on something. We've got two kinds of diplopia, guys. We've got something called uniocular diplopia. We've got biocular diplopia. Let's agree paces equal biocular diplopia. What do you mean?
Okay.
I mean
Like, by
biocular, I'm going to explain that. Biocular means that each eye looking in different direction, giving different images to the brain, and that's why you are seeing double. And this is the problem of extraocular muscle. Because the extraocular muscles are involved, that's why each eye looking in different direction, giving double image to the brain. And all of the PACES cases would be extraocular muscle cases, like sixth cranial nerve affecting lateral rectus, like third cranial nerve affecting the other extraocular muscles, like fourth cranial nerve affecting superior oblique muscle, like myasthenia gravis affecting the extraocular muscle, giving tiredness of the muscle, like Graves' disease affecting the extraocular muscle, leading to problem with vision or diplopia. So all of the problems has to be biocular diplopia. Means if the patient seeing by both eyes, each eye giving the brain different image. That's why he's seeing double. Uniocular diplopia, this is an ophthalmological cases. It's not for us in the medicine. So the patient seeing double by the same eye means that the problem within the lens. We are not going to face such cases. So, doctor, we've got the lens dislocation in Marfan syndrome. You forgot that. Marfan will never present with diplopia. So once you've got Marfan, either Marfan presented with a chest pain, or Marfan presented with a shortness of breath, or Marfan presented with long stature. Once you've got a Marfan from the general lock, you are going to ask the patient whether do you see double or not. But the double vision will never be the presentation in Marfan syndrome. So even if the patient covered one eye, this diplopia will never appear unless we cover the affected eye. This is the meaning of uniocular diplopia. So we are dealing in cases in biocular diplopia. Is it clear, Dr. Sheila?
yes, ma'am. Clear.
Okay,
Thank you. Okay.
you're welcome. Yes, Dr. Den.
Ma'am, I have a question. If this case was multiple sclerosis, do you need to do the other limbs examination and other sensory and jerk
Okay,
examination?
so if your patient told you that she got any other neurological manifestation, like if your patient got pins and needle sensation, you have to examine the sensation. If your patient told you that she got weakness, you have to examine this weakness. But if the patient told you that this problem recurrent and she lost her vision once, then she regained her vision. So you are dealing with optic neuritis, history of optic neuritis, and now diplopia. So it could be MS. Once it could be MS, and no other neurological manifestation or acute weakness for the time being, the only examination that you have to do beside the eye examination is going to be the pathological reflexes. What do you mean by pathological reflexes? Either Hoffman or Babinski, Dr. Den. Is it clear?
Thank you, madam. Yes, it's clear. And I have another question for this
Yes.
for this station 5. If we just tell the findings, it's a sixth nerve palsy. Do you need to mention the diagnosis also, like due to what, like ischemic diabetes, or do you
Yes,
need to
you
find the
have.
exact?
Yes, you have to, because the management plan is completely different. Because the examiner will ask you three questions: what are your findings? What's your diagnosis? And what's the management plan? So those are the fixed questions in station 5. So once the management plan would be affected, you have to know the cause. You have to mention the cause. Most probably related to his diabetes. Did you
Thank
get
you,
that?
ma'am. Yeah, thank you, ma'am, for clearing.
Okay, you're welcome. Any question,
Dr. Alam,
guys?
do we need to
Yeah.
offer window here for ruling out papilledema or diabetic changes?
Okay, so Dr. Kerti already offered fundoscopy, and I've told her no need.
Okay.
Okay, yes, Dr. Alam.
Yes, ma'am. This patient having a right-sided sixth nerve palsy.
Yes.
So if I close the her left eye,
Okay.
and if she see towards the right side of her right eye, so
Okay.
she will see double vision or not?
No, no. If you are going to close the right eye, she will never feel double vision. If you are going to close the left eye, she will not have the double vision. So the cause of the double vision is that she's receiving two different images. That's why she's having a double vision. Once you are going to close any eye, either the affected eye or the normal eye, she's not going to have a double vision.
Oh, okay, ma'am. Thank you.
Okay, you're welcome. So thank you guys for today's session, and see you next week, inshallah. Be safe and study smart. Salam alaikum.
Thank